Hi, my name is Lynn.
And I'm Brittany.
The Valgus Stress Test of the elbow is used to determine the integrity of the medial collateral ligament, or MCL, of the elbow and the medial joint capsule. The test is conducted in 20 to 30 degrees of elbow flexion because at this angle, the anterior fibers of the MCL provide the primary resistance to valgus forces. The ligament is commonly compromised with falls onto an outstretched arm and repetitive overhead activities such as volleyball, tennis, or baseball. Patients with MCL injuries may complain of pain, popping sensation, or inability to continue overhead activity, as well as ulnar nerve symptoms and tenderness to palpation around the medial epicondyle. You may not want to perform this test on patients with suspected or known fractures at the elbow. The positive findings of this test include reproduction of the patient's symptoms or pain, as well as differences in mobility as compared to the unaffected side.
And now I'm going to demonstrate this test on my patient Lynn. Okay, so first what you want to do when you start this test is you want to have your patient in standing to look at their carrying angle to kind of get an idea of their baseline and how much valgus they have at their elbows. Okay, so when you begin this test, first you want to find a comfortable position for both yourself and your patient. I prefer to do it in sitting. Now I'm going to perform a test on you with your elbow to see if I can reproduce any of your symptoms. So you may experience some of your symptoms that you've been complaining about.
Okay.
So now you want to place the elbow in about 20 to 30 degrees of flexion and full supination. You want to stabilize here at the distal humerus, and you want to palpate the medial joint line. Then you want to apply a medial to lateral force at the forearm, creating a valgus force. Do you have any symptoms?
No.
Okay. You want to do this test bilaterally, starting with the uninvolved side first. So I'm going to have you flip around, and we'll do the other side. Do you have any reproduction of symptoms?
No.
Okay. Lynn didn't have any reproduction of symptoms, but if your patient does have a positive test, it may be significant that they have a ligament or a capsule sprain.
Thank you.